And this is for everyone, whoever wants to begin. In your previous work, whether in the protesting or the peace organization or civil rights, how did you feel as a Black woman? Empowered, overwhelmed, joyous? I know, Arri, you briefly touched on that when you did a Black Women's Walk recently in your community. How did you feel during that organization of that protest?
I think I feel all of those emotions. And sometimes you can feel all of that in just one moment. I feel empowered most of the time, but I get overwhelmed. And sometimes I have to just take a break for myself because if I'm not recharged, I'm no good in the movement. And I take a back seat when I start to feel that way. And sometimes that's often. I take a break from social media when need be, take a break from actually watching the news if I have to. Working in a newspaper industry, sometimes I'm just overly saturated with negative news, and that takes a lot out of me. So I do spend a lot of time recharging, a lot of time meditating, a lot of time in prayer, a lot of time eating right and doing what I have to do so that I can be my best self. And I think it's important that all of us Black women take some time to recharge and rejuvenate, because what can we do when we're exhausted?
You know, and I have to piggyback off that and agree. A few years ago, I did a lot of work with the Dream Defenders in Florida when I was living down there. And I will never forget, it had gotten to a point that I was crying every single day because I was constantly, I mean, the constant negative news and being out in the streets, you know, doing the protests, doing oh, we're getting a lot of feedback from Essie.
Let me see if I can go ahead and mute her. All right, go ahead.
But yeah, so thank you. It had gotten so overwhelming. I had to take a step back from the movement because it was affecting my own personal health. You know, when I tell people this story, I said, you know, I never had children, but I felt all of the pain of all of the children that we lost. And it was too much for me. And so when I stepped back, I focused on myself, my health, my work, etc. And here I am a few years later, I had to come up with a different approach to help me remain engaged in the movement and in the fight. So this year, I'm not out in the streets like I would have been before, but now I'm doing a lot of back end work. I'm doing more organizing in the background, and also making sure that I practice mindfulness in the process, because, you know, to Ari's point, it is quite overwhelming, and it's truly a roller coaster ride of emotions that one goes through with dealing with all of this. I have not watched mainstream news in weeks. But yet I'm still very much aware of what's going on, and it's because it's in our face every day. So, you know, you have to pick and choose where you're getting your information from. So if that means cutting off from social media, cut off. If that means, you know, just getting up and say, you know what, I want to laugh and go watch a comedy just to get your mind off of things, one must do that, because we need all of us at our best for the fight. So basically, yeah, it causes more harm to the movement when we individually are not at our best. To the topic of these emotions, to the listeners and those who are watching, I would highly suggest, especially now, there's a lot of research showing that depression levels within the Black community has deepened. And I think that this is an opportune time for all of us to say, hey, you know what, let us go find that therapist. Right. We all, both Black men and women, we have, I believe that all that has transpired has reawakened a lot of the trauma that we have, you know, the generational trauma that we have. And we really do need to talk through it in order for us to continue to be at our healthiest, to fight for what we want for the future. And so that's something I'm hoping that everyone who's on this live really, really takes into consideration. Find that therapy, like that therapist. Even myself, you know, I'm saying this, I'm in the process of looking for a new therapist because you need to find someone that you're not only comfortable with, but you feel like you can trust with all of these vulnerable topics when it comes to racial trauma that we've all experienced. Even if you personally have not experienced racism because of the sheer nature of the color of your skin, you have experienced it, whether it had been through the infrastructure, your education, your healthcare, etc. And we need to talk through these things in order to move forward.
That's a great point, Charlaine. I think that a lot of us don't realize that we can have access to therapy through our health insurance coverage.
Mm-hmm.
So that's something everyone who's watching can look into. You might be covered with a few free therapy sessions, so look into it.
Yeah. And then I think Taraji P. Henson has this program that she's supporting right now specifically for free therapy for Black, I'm not sure if it's for Black men as well, but I do know Black women also. And if you Google therapy for Black girls or therapy for Black men, you'll find resources that actually has Black therapists open and available for us.
I was going to think about that point because I was thinking the most effective therapy that I felt like I received was actually from a Black woman therapist.
That's why I'm on the switch right now.
Yeah. I don't know. I guess it was that immediate community that I kind of felt that, okay, she can get what I'm saying compared to I've been with other therapists who are from non-Black, and it's like, you
don't feel judged.
I'm getting therapy, but I'm not getting therapy, like deep into the root of the issue and understanding, like, okay, like you've been through this or something similar, so you understand. There's definitely some strength and some like safety in that.
Mm-hmm.
Okay. As we're waiting for Essie to connect, I definitely want to go on and talk about the pandemic a little bit. Since we were talking about mental health issues, how has COVID-19 impacted you mentally, emotionally, physically, everythingly? Let me know. Arri, I'll let you start.
It's been tough. It's been tough. And I think that we're allowed to have a safe space here and just say, like, it's been a struggle just trying to figure everything out. But I've been super intentional on taking a lot more care of my health. I see a lot of people that are turning up and getting wine down here in South Florida, but I think it's super important for us to think about our immune system and how we can best protect ourselves. And so we may want to avoid some of the vices that we're using to cope. Let's see, emotionally, I've just been trying to stay positive for my husband's sake. He's an educator, and that's its own battles. My children are doing, they were doing virtual learning, and that was a challenge in itself. So many times I just have a smile on my face, and I'm just trying to make it happen for the family so that their spirits don't weigh down. But otherwise, I guess I'm holding in there, hanging in there, doing the best I can for everyone else around me. I do have friends who have been impacted by COVID. I have a friend right now whose fiance is on life support as complications due to COVID. So this is very, very real. And we don't realize it until it knocks on our front door. So while you're fighting, those who are fighting, make sure you have on a mask at the very minimum, but I'm sure we'll talk about that in a little bit.
Welcome back, Essie. Oh, hold on. Let me see if we can go.
You guys hear me?
Yes, loud and clear. The question was, how has COVID-19 impacted you mentally, emotionally, and physically?
Oh, yeah. So, I wanted to speak on that and also kind of tie in a little bit of the last question about like showing up in the space and the movement as a Black woman and everything else too. I think that, because it all connects because everything's happening at the same time in 2020. I think that there is a lot of empowerment that is felt when it comes to doing this work because of the impact that you have in doing the work. I think that if you are an organizer, activist, or whoever, I think that sometimes getting caught up on the what and not the who can leave us feeling overwhelmed and can also leave us feeling very, drained, discouraged. And so for me, it's been focusing on the who and focusing on the little and not so much on this marathon, because it's a marathon, not a sprint that we're in. But I guess with that being said, with COVID-19 in the beginning, it was a little bit tricky because I think that folks were not expecting, I think Americans were not expecting to be impacted. Let's be honest, Americans were chilling when it was outside of the borders, but when it came in the borders and it shut down, everyone was like, what the heck? And so I think that it took some adjusting, especially since when you're working amongst a community that is vulnerable. At first I felt really overwhelmed because in Florida is like the worst place to be impacted by the pandemic. Not only are our people in the office are being dumb, but also like the unemployment sucks and all that stuff sucks too. And so many folks were impacted by that, and like trying to readjust to how you were doing things and doing things virtually, and like having folks who need help like demand so much of your time felt really overwhelming, and there was a lot of adjusting to do to that. And then also I was impacted as well, so that was a lot. But eventually I've kind of not so much focused on just the big pandemic. It's just a lot of resting, a lot of slowing down, a lot of just like my phone's been on do not disturb so that I can control what's coming in and out of, like, basically it's just a form of being able to control, like, I'm allowing you in my space, not so much of like everyone can just make demands on me, especially when you're giving so much of yourself. Like my phone's been on D&D. I've been just resting. I've just been trying to just lay low, trying to use this moment, because I mean, everything happens for a reason. If we're going to be honest, like God has a way of doing stuff. And so I'm using this moment to breathe and recollect for whatever's to come when we get out of this. And so that's kind of been how I've been dealing with it. That's where I'm coming from.
I think I'm in a little bit of a different situation, because I've been living in this type of situation for a few years now. Not because of COVID, but COVID just so happened to be an extra thing that's keeping me at home. And that's simply because I'm still rehabbing from a horrible car accident that I had. But I will say this. What this pandemic has revealed is really one of the issues that we have with American ideology, and that's the individualism. Mm-hmm. We don't care about our fellow man enough to at least say, hey, you know what? Let me listen to the scientists and try to do my part to control this. And as a result, our country is suffering most compared to the rest of the world. Mm-hmm. And in addition to that, we have people, and especially the Black community, that are suffering because of this. It has revealed what the Black community has been saying for generations about these infrastructures that are not meant to help us or protect us in any way, shape, or form. And unfortunately, our neighbors are still ignoring this fact and not doing what they can to help us out by wearing their masks, by washing their hands, just the little things. Mm-hmm. So for me, during this COVID, it's been more about trying to do my part as a health educator. Okay. And do my part to talk to even my own brothers and sisters about what we need to do to protect one another, because we have too many things that are affecting the Black community, and we don't want for COVID to be the other thing to wipe us out, or to attempt to wipe us out, I should say.
To ask you guys, how has COVID-19 impacted your relationships, maintaining friendships, and also, if any, loved ones?
That's something that my sister and I talk about all the time. But it's a struggle to talk to those who don't want to listen, who fear that they are invincible. Yes, we are all young, all four of us, we're in our youth, but that doesn't mean that we should sacrifice the elderly, because they're at much higher risk, and we're still going out and partying. We're still going out to the beaches, and we're still doing all of these things that are putting lives at risk. And it again goes back to that whole individualism as opposed to the community mindset that most other countries have, and that we are lacking. I do believe that, unfortunately, COVID has been overly politicized, that it has kind of shifted from being a health issue to a more political / racial issue as well. And this is the reason why we're having such problems with trying to address it. Okay. If it was kept to a health concern with the scientists and the experts being at the front lines, then maybe we would have been in a different, state of being. That's just my perspective on it. But we as Americans have shown our true colors in the fact that we don't care about anyone else but our individual selves as a whole.
I wanted to add something really quick, because I think that this COVID-19 situation is very complex, and I think that it's going to get politicized because it's happening in the middle of an election year. I mean, just to even give some perspective, in Florida alone, we're like, we already know the state of the climate politically, but in Florida alone, we're the lowest in benefits, but also like there has been studies that shown that the system has been rigged to keep unemployment numbers down. And it's the same thing with COVID-19, that, our president is trying to keep cases numbers down, and so I think that it's really hard to avoid it as it becoming a complex political or racial thing. I do feel like a lot of the mandatory shutdown ceased because once we found out that our community was being impacted the most, it was kind of like, okay, cool. Yes. And I think that it's not just because of behavior modification that's becoming. I think it's also because a lot of our community experience underlying health issues. So it's not just elderly, but also if you're a young person and you're not healthy, you can also be vulnerable to COVID-19. I just think that a lot, in spite of what personal feelings, like I guess, or to your point of individualism, I think there's a lot of personal feelings that folks have about COVID-19. And I have some personal feelings too, but I think that that does not matter, because at the end of the day, if people are dying, that's all that matters. And so I think that at the most we can do is be mindful, not just taking precautions against the virus, but also be mindful of how the intersections of this disease too. It's not just a health one, it's an economic one. A lot of folks have been furloughed. A lot of folks have become primary caregivers and cannot work. There's an economic crisis that's also, impacting Black and brown folks as well. And then, of course, we all know how the healthcare system is also racialized as well. So that's becoming a thing. And then you got protesting happening, and then folks are, and then like they're exposing themselves to the virus more. So there's a lot of complexity that's happening around this. And I just think that it requires us to, I guess, like you said, think outside of ourselves and be mindful of the precautions that we can take. Like for folks making the choice of protest, maybe quarantine yourself before you come back home for 14 days after you protest, and if you're saying, I don't want to protest, like I haven't gone out protesting because I'm like, I live in really close proximity with my grandma, my mom. I'm not putting them at risk. Yeah. And so it's like, if you're not going out there, okay, there's other things you can do to ground yourself in this moment. Just thinking about not just yourself, but thinking about others. And I think that a lot of other countries outside of America has had less cases because they thought about themselves, about others. I mean, I think we've been
I would like to add to that just something. NPR reported, I think this was last week, if not, it was earlier this week. They actually did a study that found that the spread of infections were a lot lower for people who are protesting compared to those who are going out and partying. If you really pay attention to those who are protesting, many people are actually still practicing PPE. They're wearing their masks, they're wearing their face shields, etc. But more importantly, they're also outdoors. So that also helps to reduce the risk. But they're actually finding that social events and gatherings with people not wearing masks and parties and closed quarters are actually the ones, when they're doing the contact tracing, they're the ones who are actually contributing more to the problem. So it's quite fascinating, because I know the argument right now in the media is, well, what about all these protesters? They're out there, they're spreading the virus. And the truth of the matter is, it's the people who are, like, for example, here in Maryland, a guy who had a party in his home with 60 people, and so many of them came down with the illness. It's just, we have to again, to reiterate what I said earlier and what SC said, we have to start thinking about our friends and our families and be more mindful of them. I live with an elderly couple, both in their mid-70s. I'm definitely not going to go out there, not because I physically can't, but I'm mindful of that, and I'm not going to bring that back home because they are at risk. And heck, I'm at risk. I'm no longer in my 20s. So, you know, we have to really, really be more mindful. Too many things are already killing us off, Black people. Too many things. Let's not increase the risk, you know, to ourselves because of our selfishness.